Myotonic dystrophy is a type of muscular dystrophy. It is best described as a muscle disorder, mainly causing weakness in the muscles, but can also affect some other parts of the body. Myotonic dystrophy is an inherited disease passed down through genetics. It affects 1 in 8,000 people and is the most common type of muscular dystrophy in people of European descent. The inheritance pattern of myotonic dystrophy is autosomal dominant. This means that it shows up on one of the chromosomes of the member, so it can be inherited from either parent and is a dominant trait. So if only one parent carries the gene, you can still inherit myotonic dystrophy, and there's a 50% chance of getting it. The affected gene is the DMPK gene, and the mutation of the gene takes place in an area called the intron, which comes after the coding of the protein. The mutation is attached to in this intronic area is where the spelling difference for myotonic dystrophy takes place. The unique mechanism for this disorder is that it's a trinucleotide repeat expansion. This means that three bases create a pattern, and in this instance, three bases end up repeating themselves, and instead of having a normal repeat, there is an expansion. So the bases CTG keep repeating themselves, and depending on how often they may repeat, that correlates with the age of onset. So the more repeats, the earlier onset will occur. The standard number of repeats is 35 and under. A mild number of repeats is about 50 to 150, and this is a mild or adult onset. And the onset of this is variable and can happen between the ages of 20 and 70. Then the classical number of repeats is anywhere from 150 to 1,000, and usually onset occurs in childhood or young adulthood. And then the more rare but severe congenital kind is above 1,000, but it's usually somewhere around 15,000 repeats or 35,000. And this presents usually at birth with weakness, having trouble feeding, and sometimes trouble with breathing. There are two main types of myotonic dystrophy, BM1 and BM2. BM1 is much more common and has more muscle weakness, where BM2 usually presents with muscle cramping and has more issues with the heart muscles causing cardiac arrhythmia. BM2 does not worsen with each generation. It usually stays the same when passed on, and it typically doesn't have onset until adulthood. BM1 takes place on the DMPK gene, and BM2 occurs on the C and D gene. Diagnosing myotonic dystrophy starts with a lengthy family history. But one unique feature of myotonic dystrophy is in addition to being weak, the muscle also has a hard time relaxing after being activated or can cramp up. So sometimes doctors will tap the muscle to see if it is stimulated with a tap, and that is called the myotonia, which means increased muscle tone when triggered. So they can diagnose myotonic dystrophy when a person comes in with muscle weakness, but at the same time, they can induce myotonia by tapping, and just by tapping will contract the muscle underneath. A blood test can also be done to determine if there is a mutation and where the mutation is to determine which kind of myotonic dystrophy it is. The symptoms of myotonic dystrophy include muscle weakness, usually in the face and in the lower legs, such as the calves and feet, and myotonia in the hands. The onset of symptoms is variable, and the presentation of symptoms is variable. Some of the symptoms that can also be experienced are cataracts, myotonia, cardiac arrhythmias, dysphagia, excessive sleepiness, bowel problems, and many symptoms that occur with aging in normal people will occur earlier in people with myotonic dystrophy, such as diabetes and trouble breathing. When women with myotonic dystrophy become pregnant, this can cause the onset to occur sooner. These pregnancies will be monitored closely, and usually the women will have to deliver the baby by C-section, because during labor, labor the muscles of the uterus and spasm randomly during delivery. Unfortunately, there is no cure for myotonic dystrophy and no medications to help minimize the symptoms or slow onset. Once onset occurs, people can usually go to physical therapy to help. Also, it helps to stay active and eat healthy.